We're going to draw a case that prompts you to perform lower quarter screening exam, and I will tell you for sure on Friday, but you can eliminate vitals, cranial nerve, lymph nodes, and posture, I believe. But you will still do gait. And gait, just they're going to walk, you're going to ask if they're pain. So don't spend a lot of time on it. You're not doing a full analysis of that. I think that's it.
You don't do vitals?
You will not do vitals for this practical, no. Because I'm assuming in practice you're gonna get easier. So I don't want you to time-wise, just want to keep it more condensed. So you will not have vitals, cranial nerve, lymph nodes, or posture.
For upper and lower?
Correct.
For lower. You do have posture for upper.
We just say, oh, your vitals are good. Nope. Don't even acknowledge it. You didn't do it for upper.
Posture either?
For this one, yes, no. I believe it's no posture. I think I left on this because I left on gait.
But I mean, like, acknowledge that we say we look at posture.
So you're no, because it says the way I wrote the case. You know, it says the case. Then the number one is the question that your tester is going to ask you before you start. Then the second part says you feel it's safe to continue on with the lower quarter screening exam. Parentheses, you can eliminate posture.
The posture upper or gait lower?
Correct. I think it's correct. You're doing posture on upper and you're doing gait on lower.
And no vitals on either.
And no vitals on either. No lymph nodes and no cranial nodes on either.
No vitals, no lymph
Okay.
nodes on either.
Now this is the one where I usually do skip something. So those of you that have your computer, yell at me right when I skip it. That way I can throw it in. What do you want to have? Low back pain? Sure. Okay, so we'll just say right-sided low back pain. So your case will have an identified problem on the practical, but your patient is each other. So you'll say to them, tell me if you have that right low back pain with anything that I do, blah, 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 blah. But they are to act like themselves. They are not to try to decide when they should hurt and shouldn't hurt, because that gets way too confusing. So if you have absolutely nothing wrong with you, you are going to have absolutely nothing wrong with you when they do this exam. Does that make sense? Okay. But you'll continue to say, does it cause that right low back pain? No, no, no. Okay. Good? All right. You good, Mariah? Okay. So based off the subjective history, I want to go ahead and move on to my exam. So I want to do a screening exam that just looks at a few different regions of your body, just to see if we can pinpoint closer to where that pain is coming from, that right low back pain. So make sure you tell me if you have that pain with anything that we do. Okay? Makes sense? So I'll ask a lot. It's going to get annoying. Does this hurt, or does that cause that right tightness? Okay? Let me have you stand up for me first. Let me keep your shoes on. Step forward for me. So I'm going to look just generally at your posture with that bright light in my face. I'm just doing it now because I'm on the whole exam. I know, I thought about that. Papa right when he said that.
Okay.
So are you ticklish? Relax your arms for me. So just checking landmarks there. Now let me have you walk towards that door for me. And then come back. And let me have you do it one more time. Any of that right sided low back pain when you walk?
No.
Nothing at all?
No.
Good. And then come back for me. Okay, good. And then I'm going to take your hands. Let me have you squat down for me. Just take it to a squat. Good. Any of your right-sided low back pain with that? Is that as far as you can go? Okay, go a little further then. Go as far as you can. Good. And then back up. No pain with that. And then now what you do is you're going to raise up on your toes and you're going to just drop suddenly down. Any pain with that? Does that cause your right-sided low back pain? No. Okay. And how about come up on your toes for me and then take a few steps towards me. Hold towards me. Good. And then down. Now you're going to come up on your heels and take a few steps towards me. Good. And no pain with that either, right? Good. Let me get you to have a seat right there. That was it. I know. Did it hurt? How about when you come to sitting? Does that cause your pain when you're changing in position? Good. And then from here, I'll have you slip your shoes off if you don't mind. And then let me have you lift that right leg straight up in the air. Any problems with that? No. How about left? Nothing. And then keep your right leg straight, and then bend back. And then how about left? Nothing at all. And then lift toes up towards the ceiling as far as you can go. And then out. Good. And then back down. And then how about right? Good, just like that. And then toes in for me. No problems at all? No. And let me have you take that right foot. There you go. No problems at all? Good. So let me have you scoot back just a little bit for me. My tones before German tones? Yes. Okay, good. Let me have you lift that right knee up toward the ceiling. Hold right there for me. Don't let me move. Hold. Any of that right side of back knee? Good. What about left? Hold right there. Any of that back knee with that? Not at all? Good. And then let me have you kick both out. Kick. Anything with that? None at all? And then pull back in. Pull. No pain at all? No. Right, pull it out. And then I'm going to raise you up here. Let me have you. There you go. Flex ankles up for me. Hold them right there. Don't let me move them. Good. No pain at all? And then how about big toes up? Hold. You can move them all up though. But hold this right there. Do this side again for me. Hold it there. And then let's do this one. A little weaker on the right side. Just a smidge. But I'm not worried about that. And then let me have you do this foot out to the side. Hold it right there for me. Hold. Any pain at all? Okay. And then this one out. Okay. Hold right there. Hold. Nothing at all, right? Good. Okay. Then I'm going to have you scoot back just a hair more so you're a little bit safe on table. I'm going to check sensation. Touch just a few spots. Tell me if it feels the same on each side. So I have you just close your eyes. Okay. Right there. Oh, it does? Done that. I'll do it. I can't get the back of right there. Good. Let me open your eyes. Now I'm going to check your reflexes. So completely, but don't have to relax that way. Good. Oh, I got you on that one. So, put that hyper there. Are you doing that hyper there? Huh. Relax. You did. Huh. You did. Relax.
It was hyper and funky. Yeah, the actual stuff.
No, I'm just checking on her because that's not normal. I have one. But it was just that one. Your others are all about the same. So you were very jumpy right there. You've always been that way?
Yeah.
Okay. No, just wanted to check that. Guys.
Make sure you're
Yeah. What was that? Let me have you line back for me. Head here. How about now when you change positions? Any pain with that? Doesn't bother you at all to roll? Okay. And then I'm going to straighten your legs. You okay there? Yes. That one doesn't bother you? Okay. Let me check the pulse first. Ooh, nice and easy. You made that easy for me. How about, are you able to look down at your toes? Does that bother you at all? Good. Okay. Let me have you take this right knee and bring it up towards your shoulder. Okay. Any pain with that? No. Nothing in your back? Good. And then come straight. And then how about left knee? Any pain with that? No. Okay. So let's say she only went to here, then I can just come behind. Anything with that? Nothing? Good. Spin this knee up, sliding foot on the table as far as you can go. Good. And then go all the way straight. How about this leg? Nothing at all in your back still. And let me have you tighten these muscles. There you go. Any problems at all? Good. And then relax this leg. Don't help. Hardest thing I'll ever ask you to do. Don't help. Just look at your flexibility of your leg. Good. Relax this one. Don't have any pain at all. Oh, good. Hamstrings aren't bad at all. Now, how about lying here? Let me have you lift that leg up. Just about. Good. Nothing at all. No pain. And how about this side? Nothing at all, right? No pain. Good. Let me have you. But I didn't check landmarks. Move that. Well, I'm going to have you turn onto your tummy. But we're going to move this pillow down here. At your hips, either way. And then just you can move your head off to the side. How about now when you change positions? Did that bother you at all? Cause that right side of the back pain? No. Nothing at all? Okay. let me have you, left leg, I want you to lift this leg just up off the table. Good. And back down. Any pain there?
No.
And then how about this leg for me? Nothing at all?
No.
What about bending this knee up? No pain? And then this one for me? Good. Nothing at all? Okay. Well, let me have you come back to sitting. So far, based off of everything, it doesn't seem to be coming from anywhere in your lower body. So I want to do just some more specific tests to your low back and see if I can cause that pain so we can pinpoint just a little bit better where it might be coming from. Is that okay? Good. Sleep anything? What was the shoot? Darn it. Look at that.
That's the baby.
That's the baby feet.
You should.
Darn it.
Should we curl or should we not?
You should not.
We should not curl.
It's not supposed to flare.
So curling is fine. Splaying that?
It's the splaying. You should draw, you should almost plantar flex and draw
Yeah,
away.
I was
What you shouldn't do is go, woo, up. Okay, so relax there. And you have to use, some, like a pen, a top, decent end of a pen, or a top of a pen, or the end of the reflex camera. Shoot, I thought, oh yeah, remember everything for once. It's gotta be fast, and you gotta add pressure. Yeah. If you do this, it won't work. It's a C shape, and it's quick. Well, and you can really only get it once. Yeah. So you go. You go like that. Yeah, I know. It's terrible. Yes.
When you had her do the calf raises or the walking, is that not your strength?
It is. Yes. But it's E version for what?